So now I'd like to introduce the Medicaid transition team. Sandra Villalvazo-Warner, Cherie Stagner, and Vanessa Justice. They'll be talking with us today about Medicaid transition as individuals with disabilities move being a youth to a young adult in that complex system. So welcome everybody, and please go ahead.
Good morning. Thank you, Maria. I'll start off with introductions. My name is Sandra Villalvazo-Warner, and I have been with state service since 2005. I have been a licensed social worker since 2015. So I have a few years under my belt when it comes to Nevada Medicaid. Currently, I am a social services manager here with the Nevada Medicaid office. And the Nevada Medicaid office is now known as NBHA, Nevada Health Authority. We work with members once they're insured. So once they are approved for Nevada Medicaid, we help them manage their benefits and also send, if they need, send referrals to other agencies based on their needs. We are now currently statewide MCO. So a lot of our members are now linked up with an MCO, a managed care. So our office just works with our fee-for-service members, which are our disabled individuals that have MABID, our DCFS children, incarcerated children, people that do not lie in that childless adult category. So that's a little bit about me. I'll go ahead and give it to Cherie.
Hi, I'm Cherie Stagner. I'm a nurse and supervisor here in the Reno District Office for Medicaid over the customer service team and care coordination. I have dabbled in a few different things with the state, including Katie Beckett previously, so I have a foundation there, as well as our adult population now, and assisting, like Sandra said, the MABID population, disabled adults and children, and so forth. I'm glad to be here.
Good morning, everyone. Justice, and I'm with Division of Social Services, previously known as the Welfare Office. I've been with the agency for 25 years this year, and I've been at the agency the whole time, hoping to retire from here. But if not, I'm blessed and I'm thankful. Thank you for having me here. I've been with the outreach team for the last 3 years, and so I am out in the community, many events and meetings and presentations like this one. So I'm just thankful to be here.
Thank you.
You all mentioned MABID. Could you just explain what that acronym stands for so people know what program you're speaking to? Thanks.
MABID is MABID is medical for aged, blind, and disabled. I know it sounds funny, but yes, it's MABID, and it's just the acronym basically for each letter. Medical for aged, blind. And we'll be talking about that shortly.
All the time, and it slips our mind sometimes that we're talking to non-Medicaid people. So you'll hear us say childless adults or MABID or this, but please stop us if you guys get any clarification on this. Can everybody see my screen with the slide?
Yes, Sandra.
Okay. So we did our introductions. Bear with me while I go to the next slide. Okay.
So with Katie Beckett, eligibility option, that's for age 19 years and younger. It's a program for families that make too much income typically to qualify for Medicaid insurance. And so it gives them another avenue if they have kiddos that meet the nursing facility or the intellectually delayed level of care, meaning that their care in home costs as much or maybe more as it would in the hospitalized setting, but the family would like to keep them at home. So that's an option for them to keep the child at home and still qualify for assistance with medical insurance to help cover the expenses that can be incurred when you have a medically disabled child. And so some of the qualifying factors, if you don't already know, for that program is that you have to qualify for Social Security, but be denied due to the income of the family. So that has to start the process, and then you would work with the Medicaid office on seeing if you can meet that level of care with our healthcare coordinators on the Katie Beckett team.
So Katie Beckett, like Cherie mentioned, it's up until your 19th birthday. So a lot of parents, after their kiddo, let's say, graduates or ages out of our program, they're kind of at a standstill. Like, now what? Now what do we do? So this is where welfare comes in. Oh, and I'm sorry. Welfare recently changed their name. They're now the Division of Social Services. So you will hear me call them welfare still, because it's been 20 plus years, and to me, they've always been welfare, but Vanessa will correct me. Now they're the Division of Social Services. So Vanessa's going to chat about basically how to check into Division of Social Services and see what you are eligible for. And that's the starting point. So
Yes.
Vanessa, take it away.
Thank you, Sandra. Yes. So what happens when you or your family need medical assistance? It has to start at our office. We do the eligibility. And so when a person needs Medicaid, they need to come through our office and come and apply. There's several ways that you can apply, but that will be in the next slide. So Medicaid, of course, in Nevada covers several groups. We have different criteria like family medical coverage, medical for aged, blind, and disabled. We have Nevada checkup, Medicare beneficiaries. And so we also have categories in the family medical groups, like childless adults between 19 to 64 that could possibly be eligible. And also, as well as, from children from birth to age 18. And like we talked about, Nevada checkup as well. That's our CHIP program. And so some children that may not qualify for Medicaid because of a parent's federal income that they make a month, they may be eligible for Nevada checkup. So there's different guidelines, different income guidelines that we look at for everyone in the household. We can also have a pregnant mom in the household. And so every individual is looked at very differently depending on their income. There's possibility that sometimes families with different children in different ages, some kids may be eligible for Nevada checkup and some kids may be eligible for full Medicaid. So that can happen. We're always going to encourage for families to apply and let us do the eligibility. And so MABID, like we talked about, is medical for aged, blind, and disabled. And this program provides healthcare coverage for individuals who meet either one of the categories: age, disabled criteria, or of course, blind. It ensures that they have access to care they need. And so there's two categories in that. Like we said, the Title 16, which is the SSI category. If someone is receiving SSI, they will receive full medical. If someone is receiving the Title II, then they will be receiving the RSDI. And so when they're receiving the RSDI, that's when we take a look and see what Medicare beneficiaries they may be eligible for. They may be eligible for us to help them pay their premiums, co-insurances, and deductibles. So there's just very many different categories. Next slide, please. How to apply. So in our agency, we've done many changes in the last year. You can click in through Access Nevada portal, you can call in, or you can come into one of our agencies. You can click in our Access Nevada. We've upgraded it to 26 programs with sister agencies. And so there's just many, prior to us making the change, we only had our programs on there, which would be food stamps, Medicaid, and TANF. TANF is cash. And so now we have our sister agencies that if people need services in other agencies, they can select it right on that screen through Access Nevada. Access Nevada is a one-stop portal, and you have to have an email for you to create an account, and you can receive notifications via phone, email. It's just the easiest and most convenient way for customers to be connected in real time. We've also increased our call-in services. We have expanded and upgraded our call system to assist triage our calls, and depending on what you're calling for, we can do telephonic signatures for food stamps, Medicaid, and MABIT, Medical for Aged, Blind, and Disabled. So someone can just call in. They will do the interview over the phone and accept a signature over the phone. That's also been one of the upgrades we did last year. And then also you can come in. We have several offices across the state. If you can go to the next slide, please. Here are our northern offices. We have a few in the rural areas, and of course, Reno, Sparks, and Carson. And Yerington, Fallon, where else? Where else do we have? Elko, of course. And then in the southern, the next slide, please. The southern, we have many more. We have many, many more, many locations. If you, you're welcome to always reach out. If you need a list of these contact list or where to go, I can definitely send it to Maria to share with you guys. So yeah, we have different locations, and we've increased on how to apply, how do we, our Access Nevada. And yes, moving on to the next slide, please. And I think you're going to take this one, Sandra, or would you like me to do it?
You can go ahead and do it.
Okay.
Any questions about what Vanessa spoke about when it comes to applying with Division of Social Services?
I have a question / comment. I think in the past, sometimes individuals moving from, 19 into 20 and beyond didn't have to fill out paperwork. Some people just were grandfathered in, and their insurance just kept going, and some people had to apply at the transition. And it was kind of random. It would just happen with some people and not others. Is that now something that is standardized?
I'm not sure. You know what, I should have mentioned when someone applies for like the Katie Beckett program, for example, we have a specialized unit. And that specialized unit is stationed in the South. So if you guys ever come and apply, even for specifically Katie Beckett is sent out to that unit out there, Maria. But if you want to send me that question in an email, or I will follow up with the team, and I will definitely get back to you. You can share back with the group here.
Okay.
Please.
And just a comment about that. I'm wondering if, because one of the avenues to automatically get Medicaid is if your kiddo is approved for Social Security. So if they're approved for Social Security, I feel like it's a straight shot to get Medicaid.
Yeah,
So
it's 10 days. Yeah, if they're receiving SSI, it's a 10-day process. So it's really important. Now, if they don't, I mean, they most likely, because they're children and they're disabled, and so what happens is when the parents are not eligible due to their income or whatnot, then that's when the Katie Beckett kicks in. And the other thing I want to mention is we do the eligibility side, and then it goes into our sister, Nevada Health Authority, and they're the ones that pay the bills or pay the services. And so there's 2 steps to qualifying and who pays, right? But yes, like Sandra said, if they're on SSI, it's an automatic full Medicaid. So please keep that in mind.
Great. Thank you. Yes, Eileen has a question. Eileen, if you want to come off mute.
Can you hear me now?
Yes.
Yes.
Oh, wonderful. Yeah, I have a question about this 10-day deadlines. I recently just yesterday, I wrote an ADA request for an accommodation for extra time. So when I initially applied I recently moved to Story County. And if anyone has been here, you know we have a pretty hands-on kind of boardwalk. And we also do not have mail delivery. So I must use my wheelchair to access the post office. And with the recent snowfall and sometimes the inclement weather, I'm not able to get to my mailings within 10 days. So could you just speak a little bit about, I basically just wrote a handwritten letter, and I mailed it to the Carson's, I believe I mailed it to like a Las Vegas PO box. Did I do that correctly?
Do you know what ad? I'm gonna put it here in the chat. The if it's a specialized unit, do you know what you applied for? Was it the MABIT?
I believe we
program?
applied for everything. My caseworker applied me for MABID, SNAP,
Okay.
Medicaid.
Okay.
Yeah, certain letters came back to me. I was approved for the payments to my SSDI,
Mhm.
but I was, yeah, I had to have an interview in 10 days with
Okay.
SNAP, and
Yes.
that's what I missed because I didn't get the letter within.
Okay. I'm hoping, yes, you should be able to receive an extension, especially if you wrote it. We do have a direct, I'll put it here in the chat as soon as I look it up, but it's the welfare at it's welfare at mb.gov. I'll look it up and put it in there to make sure you can just send that request directly by email. So I'll give you that direct email. And I will also put the institutional information, Craig's institutional information on the chat as well. But
Thank
yes,
you.
just after you get here, just send them another email and said, I requested, I live in, what you told us. I live in Story County. I don't get my mail. I need an extension.
Okay,
And so
thank you.
they should be able to accommodate, especially you living out in the rural area.
Any other questions when it comes to Division of Social Services? Okay, thank you. So, okay.
Yeah.
If anything comes up, use the chat or raise your hand and we'll get to you. So Nevada Medicaid has a no wrong door policy. So if you come into our office, into any Medicaid office, and you just need a starting point. We are a great starting point. So we will try to guide you based on the information you're giving to us and refer you to a program that can help you. So one of our resources, one of our sister agencies is the Division of Aging and Disability. They have a lot of waiver programs for adults, and adults is 19 to 64. And then the frail and elderly population, the aging population is 64 to, however long. These are some of the programs that the Division of Aging Disability offers. This first program is, we call it the IDD program, which is programs for persons with intellectual disabilities and developmental disabilities, the IDD waiver program. This program starts with the rural regional centers. So Sierra Regional Center here in the north. In Las Vegas, it's Desert Regional. And in the rural areas, it's Rural Regional. Your kiddo would have to be approved with the regional centers to be able to get on this waiver program. This waiver program allows your child to have Nevada Medicaid insurance if approved. Okay. Another program for aging is the PD waiver. So it's for the waiver for persons with physical disabilities. This is the one that's for people 18 to 64. So if you have a disability and you need help with your ADLs, which are your activities of daily living. So if you need help with, transferring in and out of bed, meal preparation, toileting, bathing, cooking, things like that, activities of daily living. This waiver program is definitely beneficial because it'll, again, allow you to have Nevada Medicaid insurance and provide you a caseworker through the Division of Aging. Okay. They also offer a lot of bells and whistles, such as homemaking, which is light housekeeping. They offer home delivered meals. They offer that life alert button in case you fall. You press that button and the ambulance is dispatched. So they have a lot of extra bells and whistles. The goal of this program is to keep individuals in the community. So they provide a lot of resources to keep an individual safe in the community, in their home. The next program is the FE waiver, which is frail and elderly. This one is for individuals that are 64 to however long. Very similar to the PD waiver, but it's just the age difference. This is for, again, 18 to 64, 64 to whenever. The frail and elderly program, again, you need to qualify for it based on your disability and if you need help in the community, in your home. So again, if an older individual needs help with their bathing, toileting, personal care services, things like that, that would be a good program for them to apply for. The Nevada Care Connections, this is a great resource center. It's a great starting point. I have a slide. I think my next slide will talk about them. But Nevada Care Connections is a state-run program that is a great resource hub that will get you to all these programs in one step. Any questions about these 3 waiver programs? I think, let me look at the chat.
I'm
I
sorry,
need
is it
question.
okay if I just come off a mute? It's hard to type.
Yes,
Yes,
please.
I mean, go for it. Yes.
I'm very interested in the waiver for persons with PD, physical
Yes.
disabilities.
Mm-hmm.
Do you guys have a specific case? How do I start to, wait, I saw the previous slide. You told me to apply, contact 1-800-922. Anyways, is there a specific caseworker? How do I get started applying for this resource?
Yes. Great question.
The waiver.
I'll put their website on the chat. I don't think I can do it while I'm sharing a slide, but I will put their website where you can get their online application. You can also print it out and drop it off at the office. They're in Reno, they're south of town on South Meadows by Renown Hospital. Or if you need help over the phone, you can't complete the application over the phone, but they can guide you and, help you with the application somewhat over the phone, but it either has to be submitted online or in person.
Oh, yeah. I normally, if you could, I don't do anything online.
Oh, yeah,
Just make sure I get the, I can print it.
definitely. Okay. Yeah, that's one of our next slides. I'll include their website and I'll show you guys. Yes, absolutely. I mean,
I think they also have a phone number that you can call and they can assist you over the phone with that application if you have, access issues to technology or even just, limitations physically. So I would encourage you to call them.
And then I think, Jessica, at what age do you start applying for the adult part of the children? See, SRC from birth. SRC is one of the programs that you can apply at birth. And I will bring up their website.
As far as the adult programs, once you're aging out of Katie Beckett, you would want to reach out to your regional center case manager and talk to them about applying for the adult program because Katie Beckett ends on the 19th birthday. So eligibility for the adult programs, if it's the IDD or the PD, would be the 19th birthday forward.
Yes. I'm putting this in the chat as we speak. This is the website that I'm on right now. You would go to programs. Eileen, for the persons with physical disabilities, the PD waiver, here's the link. And then you would go to OCO, bear with me. Okay, it's right here on the side. Programs for persons with physical disabilities. Oh, and it takes me right here. Sorry. Give me a second. Oh, right there. I missed it. Waiver for persons with physical disabilities. There's their phone number, Eileen, and the application should be somewhere down here. OCL. That stands for Office of Community Living. You're in the rules, Eileen. So Story County, you'd probably, I'm assuming maybe be Carson City, or there's a Reno office. But here's the application. I will go ahead and copy that and paste it here in the chat. And notice how this application is for a lot of programs. You would just check what you would like to apply for. And this is not our application. This is our sister agency, so bear with me. And I believe they evaluate. So once you fill out this application, they'll evaluate it based on age and disability, and they'll place you on the correct program. So if you're 23 years old, they're gonna shoot you over to the PD waiver. If you're 72, they'll shoot you over to the FE waiver. But this is the starting point application for any of these, any of these three programs. And then I think it was with the SRC question, Jessica. Sierra Regional Centers, again, is with the Division of Aging. Okay, and Jessica, were you asking like the age to when you can apply for the regional center? Was that your question?
Jessica, you can come off mute if you'd like.
Okay, thanks. My son has been getting services almost since birth, and he's almost 16, and so I'm kind of curious like what the process is to transition to adult services. And if he's already got a case with SRC, are you saying that they're going to guide me through that?
Yes, that's where they shine. That's where the Sierra Regional Center shines. Once your kid is transitioning, meaning about to age out, become an adult, I feel like the first step, honestly, is applying for Social Security. That's the first step. If he qualifies for Social Security, perfect. Then that's one of the avenues, like Vanessa mentioned, to get Medicaid automatically. If he doesn't qualify for Social Security, then he can get on different waiver programs to be able to qualify for Nevada Medicaid insurance.
Okay, so I guess my question then is, I've heard 18 and now I'm hearing 19. So like at what point does he apply for that?
18 is when he becomes, I guess, an adult and is able to apply for welfare on his own and is no longer a dependent. Is that correct, Vanessa, when it comes to applying for Medicaid insurance?
Yes, he can apply on his own once he turns 19, and but then again, it's based on the IRS laws. So if he is being claimed by the parents, we're still going to need the parents' information. Now, if he is receiving Social Security, then totally separate, totally separate. That will be under the Medical for Aged, Blind, and Disabled program, the MABIT program. Do we know if he has Social Security?
You mean Social Security disability?
Like he receives income from there monthly?
No, not anymore, but he qualified. We don't qualify based on income, but when there was a time when we did, yes, he had it, but then
He had it, but okay. I mean, maybe if he goes on his own eventually, then they can look at him individually, go and apply to Social Security again, get his money because he'll be on his own, and then he can apply for himself.
There's more to it though, because he's probably going to need to have us as his guardians. He's got some pretty profound disabilities.
Got it. Okay. 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 Well, that would be through ADSD, right, Sandra? They would have to try to go and get it that way, see if they can help him that way.
Yeah, and if he doesn't qualify for, let's call it, I call it like free Medicaid based on income, then the waivers are the way to go, because the waiver, just in their name, it waives income. So
Okay.
limits are a lot higher. So let's say, and I'm just throwing out numbers, don't quote me on this. Let's say for a 19-year-old adult for basic Medicaid, the free Medicaid, let's just say it's $1,400 a month. Don't quote me on these numbers, guys. If it's $1,400 a month and he makes too much money because he's your dependent and they still count your income, that's fine. That's when you guys would apply for the waiver, because the waiver limits are a lot higher. It's like, I think 2,600 or so for an individual. So the waivers, these three programs waive the kiddos or the adults' income to be able to get Nevada Medicaid insurance.
If I can clarify too, the 18 to 19-year-old confusion probably came because Cherie mentioned that Katie Beckett doesn't actually end until your 19th birthday.
Correct.
Yes, they become an adult at 18 and can apply for it, but that was just in relation to Katie Beckett. Is that right? Did I say that right, Cherie and Sandra?
Yes. Yes.
Okay.
Once they turn 18, they can be eligible on their own. Just depends on those individual circumstances, if parents are claiming them on taxes and different things, but they still can qualify under Katie Beckett if they're over income till 19. But that's separate from a child that's always been on Social Security from birth because the income's low enough, and separate from Katie Beckett specific eligibility. So there's different variables and it can be very confusing.
So
Yeah.
for my son, he is on Katie Beckett. So that means that coverage extends till his 19th birthday. And so would we wait until he's 19 to apply for these things, or would we do that early anyway?
I would encourage you to do it early once they're 18, because there's oftentimes wait lists.
Okay.
And I'd like to clarify a couple of things, Jessica, with your thoughts on Sierra Regional Center. And Eileen is having some questions here about the Regional Center. You have to apply for the Regional Center by the time you're 23 to get services throughout your lifetime. Eileen, I'm not, I don't have any experience as to how that applies to someone moving into the state who is above 23. So it might be something that you might want to look into. And then Jessica, in way of services being explained through the regional center as you move through transition, I've had personal experience with this. You have to ask, you have to say, what are my options? You have to say, I'm interested in this program, in this. They do not just come out and tell you. If you'd like to have a side conversation about that, I'll put my email in the chat and we can, drop me a note next week and I can give you much more information on how to maybe move through that.
That would be great. Thanks.
Sure.
And honestly, Jessica, if your kiddo is already with the Katie Beckett program, use his Katie Beckett worker as an avenue to connect with the regional centers also.
Yeah. Well, I mean, he's got both
nudge.
on Sierra Regional Center and he gets Katie Beckett already.
Good. Yeah, use his Katie Beckett worker to gently nudge the regional centers. Because Maria's right. They you have to let them know what you need and kind of hold them to that timeline of, hey, I need this. How are we going to get this done?
Okay, thanks.
Agreed.
And I have one question for the Medicaid team that might be helpful for people moving into Medicaid to know. We, Katie Beckett, we're used to having a case manager that moved with us. Does that system go away when you get into adult Medicaid? You're just calling one number at a call center.
Yeah, there's no longer any caseworker. So once they age out of our Katie Beckett program, unless they get hooked up with one of these three waivers, they will no longer have a caseworker.
Thank you.
If they are SSI eligible and on the regular Medicaid, correct. They would just have to call our call center, and if they need help with benefits or finding a doctor or what's covered, they would just call the main Medicaid line. Correct.
And circling back to Eileen, as far as what is confusing is it's housed under Aging and Disability Services Division, so ADSD. And it's usually, as Maria mentioned, an intellectual disability that they help that case management ongoing past the age of 19. But Aging and Disability Services houses the regional centers. So the physical disability waiver is under ADSD, not specifically regional centers, unless you do have a diagnosis prior to the age of 23 for intellectual disability, and then you give that to them.
Is that better, Maria?
You can always send a question to our care coordination email, and we can have a healthcare coordinator help you further, Eileen.
So next slide. This is going to go more in depth into the programs we just mentioned. So this is the IDD waiver, the program for persons with intellectual disabilities. Who is eligible? You would contact the regional center to discuss your needs. You can apply through the regional centers. Again, in the South, it's called Desert Regional. In the rural areas, so like Carson, Fernley, Elko, those places, it's rural. And in the North, it's Sierra Regional Center. So that is the starting point for the IDD waiver. These are the services that they cover. Okay. So it enhances Medicaid, basically. And yes, Eileen, I will, I'll give you an email where you can reach out to me. Yes. So yeah, these are services that, if approved for the IDD waiver, that help enhance Medicaid, the Medicaid services that you receive. The next PD waiver, the waiver for persons with physical disabilities. Again, you would start with that application that I put in the chat. And it would have to be mailed, or you can do it online. These are the services, the enhancement services, if approved. So case management, which is a biggie, attendant care, homemaker, the PER system, which is that life alert button. In case someone falls, they just press the button and the ambulance is dispatched. Chore services, respite care, assisted living arrangements, and they also help with specialized medical equipment, environmental adaptations, such as maybe a wheelchair ramp, or maybe expanding doorways to your home, and home delivered meals. This is information about the frail and elderly waiver, the FE waiver. 65 and older, you again have to have a need, like you need to have help with your ADLs, your activities of daily living. And this program, along with the other two, their income requirements are lighter. So it allows more people to come on board this program. Their enhanced services include case management, homemaking, and they also have adult daycare, which means it's kind of like an 8 to 5 type program where an individual can go to a center. We used to have one over there at the Washoe County Senior Center. It closed down, but I believe there's one other adult daycare center here in town that can provide those services. Adult companion program, again, the PER system, chore services, and respite. Let's see here. This guy, Nevada Care Connections. This is, save this link, everybody. I'm going to, this is the link. Oh. Okay. Nevada Care Connections is a state website that it's basically, think of it like as a resource center. Okay. So it helps people, adults, elderly, deaf, hard of hearing, veterans, caregivers, find resources in the community based on your needs. So they even help with filling out your Medicaid application for medical or food stamps. Here in town in Reno, their office is located right by the not welfare, Division of Social Services office. I told you guys I was going to do that. Right there on South Virginia behind Burlington Coat Factory, kind of where the library is. And then there's an Elko office on Pine Street.
Thank you, Vanessa, for dropping that in the chat.
Yes, thank you. Yes, this is a great resource. It really is. So like the slide mentions, it helps people, older adults, people with disabilities, caregivers, families, connect with their needed resources. So basically everything that we just chatted about can be found on this website. Vanessa, if it's okay, I might have you, do you want to talk about the Nevada Health Link? Or do you want?
I'm here. Let's see. Can you guys hear? Okay, here I am. Sorry, I was playing with the thing over here. Well, Nevada Health Link, I don't know much of it really, but I know that this is where you can go and purchase, and I could be wrong, Sandra, but they can go and purchase insurance when someone is not eligible for insurance. They've added, it's going to be better, I guess. It's growing, and I know they added another team there, Battleborn, I believe it's called.
Yes.
So yes, if you guys want to purchase insurance, this is where you need to go and see pricing or what you will be eligible for. Of course, it's cost, so it's not free. But if a family doesn't have insurance through their employer, please keep this link, because this is where you can go and get a quote and apply for those services there.
Perfect. Yes, correct.
Yeah.
You're absolutely right, Vanessa.
Yeah.
This has nothing to do with a individual's disability, abilities. This is where you will go onto a portal and purchase insurance. So there's going to be, platinum plans, gold plans, silver, bronze plans. If you just need maybe a couple checkups a year, then maybe go for the more economical version. If you want, maybe you can buy a standalone dental plan. Let's just say you need dental insurance. You can do a standalone dental plan without buying medical insurance. But that's correct. There's also another program called the Battleborn plans, which is a little bit more affordable than the plans here through the Nevada Health Link, is what I've been told. But this is just a website where you can shop for self-pay insurance options. Now, Social Security Administration. We advise everybody to kind of start here, because if your dependent can qualify for Social Security benefits, these are the people that are going to make that decision and allow your individual to have based on their disability. Like we mentioned before, if they get Social Security income, then they'd be a straight shot to be able to apply for Nevada Medicaid. They still have to apply, but it's a lot less paperwork, and you're 90% there once you get Social Security. So Social Security, they're kind of hard to get a hold of and to make appointments. But I'm not even sure, honestly, if they do walk-ins anymore. I'm not sure if that's a thing anymore. But
I think they stopped the walk-ins, was the last I heard from our members, and you have to be kind of crafty at calling early hours in the morning. And sometimes there's better luck surrounding holidays when they have lower call volumes to get a call in to schedule that appointment.
yes. And I feel like one of the benefits of Katie Beckett it's up until their 19th birthday. So I feel like our healthcare coordinators for Katie Beckett start having those conversations with parents saying, hey, your child is 17, it's about to turn 18. Right now, a year before is when you have to start trying to make these calls to Social Security to try to see if your child can qualify for Social Security, so that we're not hustling and bustling right when they turn 19, and then we're at that weird transition age, 18, 19, If you guys get your ducks in a row with Social Security, the transition will be a lot easier. So.
Well, and then when it comes to things like the Katie Beckett program, Social Security is what sets the standards and guidelines that we follow for eligibility for that level of care as well.
These are just community resources. Care Chest is a great agency that provides free medical equipment. They do hospital beds, walkers, wheelchairs, toilet seats, commodes. You do have to have a prescription. You have to fill out an application, and you have to have a prescription from a doctor saying that you need this equipment. Normally, this is for people that do not have insurance, because when it comes to Nevada Medicaid, we cover durable medical equipment. That's one of our products that we cover. But let's say for some reason you're uninsured, but you do still need some sort of a wheelchair or walker or a hospital. You can connect with Care Chest and see if they have any of that needed equipment in their warehouse, and you can obtain medical equipment that way. The Northern Nevada Center for Independent Living is a great resource for individuals in our community. They provide services such as the wheelchair ramps to be accessible to your home. They do home modifications, and they also have a lot of daytime activities for individuals. So you can check out their website to see if there's any of the services that you may need, and maybe activities that you guys want to do during the day. It's a pretty good program that helps our community a lot. Access Nevada, again, is a resource hub that provides a navigation platform to be able to, okay, I need family support, I need infant support. You just click on those and it sends you to the appropriate state or county agency. Here is contact information for the Medicaid office, which is we help navigate when an individual qualifies for Medicaid. We help them navigate their services. So what's covered, what's not, how do I obtain this? What providers can I see? That's Nevada Medicaid. Vanessa works for the Division of Social Services. That's the starting point of applying. So their eligibility. So think of DSS as eligibility and us Medicaid as the insurance. Aging and Disability Services is a state agency that delivers and manages a lot of these programs that we mentioned in the prior slides. I feel like we talked your ear enough off already. Do you guys have any questions or comments for us?
I don't see any questions at the moment, but this was very content rich. Thank you so much. Does anybody have any questions? Jessica's asking if she can get a copy of the slideshow. Yes, we will be sending out that content. Well, I want to say thank you, because these are a lot of things that I stumbled over in my journey. You're giving everybody a heads up and allowing them to use this information to move forward in a more educated manner.
Of course, yes, happy to help. And honestly, us and the Division of Aging, we have a no wrong door policy. So I want to put you guys at ease to, if you stumble into the wrong office, that's okay. Someone will navigate and help you get to the right place. You have all our contact information for the offices. If you have any specific questions, here's our Reno office where we have a statewide phone queue where we answer calls. Here's the two contact phone numbers for the social services office here in Reno and Sparks. And then again, aging disability services. It says the regional centers, but it's the same phone number because it's the same big agency. It's the big umbrella is the aging and disability services, and they manage a whole bunch of programs under their umbrella.
Great, thank you. Eileen is asking, there was something you mentioned about supports for wheelchair ramps. What
Yes.
What waiver was that?
That was a program, the Nevada Northern Nevada Center for Independent Living. They offer, there is a wait list, Eileen. Was it Eileen? Yeah, Eileen. But if you connect with Center for Independent Living, let's see if I can open the link. I believe there's an application. Well, let's check it out. But I know there's a wait list, so FYI. Services.
And also, Eileen, we're going to drop that care coordination inbox where you can email us directly and we'll hook you up with a care coordinator that can answer more of your questions in depth.
Thank you, Cherie.
I would just give
Oh, perfect. Okay. Oh, thank you, Vanessa.
You're welcome.
Thank you. Yeah, I know it's somewhere on their website, and I know there's a wait list, but definitely that's a great starting point. I also mentioned that the waiver program does the waiver program for the PD. They also offer they call it environmental adaptations, which I've seen it be wheelchair ramps of like bathroom doors to be able to get a wheelchair into the bathroom, and even like outside doors to be able to get wheelchairs in and out. Again, this is all funding based, and there are wait lists for these services, but definitely these are the two places that I know of that can help with wheelchair ramps.
And Care Chest as well. Right?
Yes. Care Chest, we love them. They're a great agency.
They
Care
are a
Chest
great
is-
agency.
yes.
They'll be speaking on this webinar series as well. So we'll get to know
Okay,
more.
cool.
Yeah.
Okay, cool. Cool.
All right. Any other questions? Okay. Well, thank you all so much for coming. This has been very informative. What a great morning. If you need to get a hold of anybody from these sessions, we'll be happy to connect you. My email is in the chat, so feel free to email me about anything, any questions, any topics you'd like to see as we move forward. We have some flexibility in our timing, so coordinate topics so that we're getting the community what they need. Help us answer just a few questions so we know how to move forward with the series, and be able to report back to our funders, which again is Vocational Rehab of Nevada. We're teaming up on this project. If you are an educator, feel free to email me. Again, my email's in the chat, and let me know that you attended, and I will be able to get you a CEU certificate. Okay. Take a minute. I'll give you a minute to do the QR code survey. And I'll also send the survey out in a follow-up email. Okay, thank you all so much for attending, and filling out that survey is super helpful. as we move forward, and enjoy the rest of your weekend. Thanks for joining us, and thank you to all of our speakers. That was wonderful.
Take care, everybody.
Thank you. Bye.
Bye.